For me, the big concern, the big issue that we have about trying to transform the system is that too many of the resources, both the human resources and the financial resources, are locked up in the wrong part of the system. So what we've got is a lot of institutional care, when very often, of course, what we want and what people need is care delivered in a different setting. And the challenge here is to be able to unlock those resources to ensure that that care can be delivered closer to where people live and where people want to receive their care. The way in which we can make this most meaningful for people is to speak to people about how the system can be constructed in the best way around their needs. I mean, the difficulty that we've got, and again, a challenge for this commission, is to ensure and to make clear that people, the people who use the services and the patients in the NHS are really central to the way services need to be redesigned. We have a long history of telling people what's best for them rather than engaging with people and hearing from them about how services can best be constructed to meet their needs. Well, I think we need to find new ways of doing this. I think historically what we've tended to do is to say people don't want to engage in this, which I think is a sort of arrogant approach taken by both local government, national government, and by professionals working in the institutions, when in fact we have reasonably good evidence that people do want to be engaged in conversations and discussions about what their services might begin to look like. And so we need to find new ways at a very local level of engaging with and working with communities to help shape what services look like. And there has to be, of course, a national discussion as well. So it's not just local or national, it has to be both. And politicians are going to have to be brave about this, because if we're going to unlock resources in institutions where we want to shift those resources back to communities that can deliver that care close to people's homes, politicians are going to have to get up and have that conversation about this hospital in this locality isn't necessarily the best way for us to use our resources. Challenge they've got is people don't believe politicians very easily. Well, I got a lot from listening to other views and ideas about how we might find some solutions to this, because this isn't just about health and care. One of the things I'm taking away is the extent to which we need to think about empowering communities more generally. So we think about the wider community networks. Issues about housing are pretty fundamental to this. If we're going to be able to support people to maintain their lifestyles and their care needs in their homes into the future, we need to think about how we design, how we build homes into the future that allow that to happen, how we can respond to that even now where we have particular sections of our community who need adaptive requirements to their homes, and our ability to be able to do that is restricted, so we're limiting people's capacity to remain in their own homes, and it's costing us a lot more than we need to be spending. So those are the kinds of issues that I think have been really powerful.